Good morning, this is Dr. Rutledge, and today we're going to talk about gas, flatulence or flatus. After mini-gastric bypass, after gastric bypass, and just in people in general, there can be problems with excess production of gas in the GI tract. We're going to talk a little bit about that, why you can expect more difficulties with that if you're not careful after mini-gastric bypass, and give you some tips and pointers once you learn more about it, about how to manage this in the postoperative period. Basically, gas is normal. It can come from a variety of possibilities. One is you can just swallow air. If that's the case, it can be a problem, and it occurs in people who are eating and drinking at the same time. Sometimes people say it's with drinking with straws, eating quickly. Another source of taking in air from the upper part of the GI tract is to drink carbonated drinks, which can release CO2 when they're taken orally. So these are sources that you want to look into. Gum chewing can also be associated with it. So these are things, if you're having problems with gas, you want to look into. And especially if you're after mini-gastric bypass, those things which might be easy to manage in somebody with a normal GI tract after mini-gastric bypass, because of the shortened gut and because of the malabsorption issues, it's going to be potentially more of a problem. So even these minor little things you want to pay more attention to. The vast majority of gas, though, occurs by fermentation of foods that you eat by bacteria in the gut. And the mechanism of this and how it works is a little bit complex, but we're going to talk about it. If you look, there is the majority of gas that's created in the gut is can't be determined by smell. That is, it's an odorless gas. In some of my previous videos, I talked about methane having a bad smell, but actually methane has no smell at all. It's often a gas that's used in home cooking, and the gas company actually has to add something, a turbutyl chemical, to cause it to have the smell of, quote, gas in your home. So methane is created by the digestion and fermentation of food products in the gut, but it doesn't have any aroma, it doesn't have a smell to it, doesn't have an odor. The real agents that cause the majority of the bad smell of gas are what are called sulfides, and the hydrogen sulfide gas is kind of that rotten eggs or stinky smell. And it's one of the things you want to look out for and pay attention to, because managing that can kind of help control the problem. So aroma or the odor of the gas is a problem. The other thing is just the volume. So if you have a lot of gas, you can have bloating, distension or swelling of the abdomen, discomfort, pain, cramps, things like that. And with a lot of gas in the bowel, it doesn't work very well. So it's hard to push and move food through the gut if you have a lot of gas, because the normal peristaltic mechanism is interfered with, because it doesn't work very well with non-liquid contents. So the air can interfere with the motion, so you get bloated, you have cramps, you have pain, you feel full, and oftentimes you can have constipation and difficulty passing a bowel movement because of this addition of air or gases to the small bowel and the colon. So this interference is something you want to pay attention to as well. Okay, so how does gas occur? Well, if you eat foods that are completely digested, that means that that particular food will not be available to be fermented or eaten by the bacteria in the gut. Now, let's think of different kinds of foods. So water, for example, is absorbed easily and can't be metabolized or fermented. So water doesn't cause gas. Other simple kinds of things like salt, sodium, potassium, things like that also are not foods and can't be metabolized. Many simple sugars, like glucose, are chemicals that are not metabolized well by the gut because they're absorbed so easily by the human in the upper part of the gut, so they don't get down there. There is a whole area of new research on what's called FODMAP, and that's fermentable, oligo, di, and monosaccharides, and polyols. And this is a more esoteric thing, and so we're going to come back to talk about that, but it's a group of short saccharides, sugars, that can cause trouble. And so they include a variety of chemicals that can be found in certain foods that in rare cases in people can cause gas, cramps, and bloating. And we'll talk a little bit about that towards the end of this. The more difficult to digest foods are certain kinds of fats and starches and certain kinds of proteins which happen to have a lot of sulfite in them. And so if you're eating a diet that contains a lot of these things, you can have enough of those types of food go into the colon, in particular in the lower GI tract where there's enough bacteria to start to metabolize these foods, and these bacteria will eat the food and then release a byproduct. And if we can think about how we metabolize foods, we take food in and use and metabolize oxygen and release carbon dioxide. The bacteria in the gut doesn't have oxygen to live on, so they are what we call anaerobic bacteria in general. And these anaerobic, or bacteria without oxygen, release something as a waste product that's different from carbon dioxide. Carbon dioxide is odorless and invisible, and the bacteria, when they metabolize or ferment the food that's left over in the gut, release methane and some of these other gases, but in particular they release these disulfide, hydrogen sulfide gases. And they're the ones that particularly cause the smell. But even the even the odorless gases can cause problems if they cause bloating and cramping and things like that. So what you eat makes a huge difference. So let's think about that. There's some good examples of troublesome kinds of foods. A good example that many people are aware of is lactose and lactose intolerance or lactase insufficiency. Lactose is the milk sugar that's in milk, and what happens is that particular sugar is made up of two simple sugars, so it's a disaccharide, and that lactose is digested by an enzyme in our gut called lactase. And that's necessary to digest the lactose into the two simple sugars, and if that's not done, then the lactose can't be absorbed. If it's not absorbed, the lactose will then travel on down through the intestine, and as it travels through the intestine, it'll reach bacteria which are able to digest it. When this happens, the bacteria are happy to digest that as a food, but when they release it, the lactose being digested by the bacteria can release gas. And that gas then can cause cramping with bloating and sometimes diarrhea alternating with constipation, and can lead to some of the odors of the gas. So lactose is found in dairy products, all the milk-related products, and many times patients can have trouble with that. Now, even patients who are not having a gastric bypass can have problems with lactase deficiency or lactose intolerance. It's very common. You've probably seen lactose-free milk or lactase enzymes which can be taken to help eat dairy products. With the aging, most people lose the power of that lactase enzyme in the upper gut. So as we get older, you'll find that more and more adults find less and less that milk is to their taste. As time passes, they say, I'm not crazy about milk, when as a child, when their lactose tolerance is better, they often enjoy milk and enjoy dairy products much more. So as we get older, there's a decline in the lactase enzyme, which is normal. So adults commonly have a general migration away from enjoying drinking milk. So that's normal. It's interesting that the lactase enzyme is located mostly in the upper small bowel, so that there is a large decrease in the ability to digest lactose in bypass patients. So after MGB, we find that oftentimes a source of gas, cramps, and bloating is either recognized or unrecognized lactose in the diet. And so what I mean by that is most people realize that lactose is in milk. What you may not realize is adding milk protein to lots of other foods, bars, health bars, different other foods, makes the package look like a healthier food because it has higher protein and lower fat. So even though you might exclude dairy products from your diet and still be suffering from cramping, bloating, intermittent diarrhea, or gas problems, it might be that you're missing that there is some lactose in your diet. So you want to be cautious about that. If you're looking for the problems of gas after mini-gastric bypass, you want to carefully review your dietary intake, because sometimes you'll be getting lactose and not recognize it. So lactose is a big problem. It's usually easy to fix. And there's one other kind of interesting trick to it, and that is that yogurt, which is a dairy product which has lactose in it, is actually very well tolerated even by lactase deficient patients. So we think that dairy products are really good for you. Unfortunately, because of the lactose, many of our MGB patients can't tolerate very much of that. But yogurt is a terrific choice. It's a terrific choice, as we'll talk about, for all of the problems with gas and flatus and cramping. But particularly, it's a good way to get in the calcium that's in dairy, the protein that's in dairy, and most importantly, as we're going to talk about, it replaces the lactobacillus bacteria, which are so critical in the normal gut after gastric bypass. Even in patients who have a normal gut, it's critical to replace that normal healthy bacteria. And there are a variety of things that can, quote, mess up the normal gut bacteria, and we're recognizing that. The American diet is not very healthy for maintenance of good, healthy bacteria in the gut. We know now, for example, that there are a variety of toxic, dangerous, infective type of bacteria that we don't want in our gut. Helicobacter pylori is one that's well known to be associated with ulcers, gastritis, and even gastric cancer. And there's some good data to suggest that the addition of lactobacillus can help protect against that infection with H. pylori and may help clear it when it occurs. Lactobacillus is also important in protecting against Clostridia difficile, a very important antibiotic-associated type of diarrhea, which has now grown in its frequency in the regular non-hospitalized population. Plus, it's important to recognize that the gastric bypass causes an abnormal GI tract. And so our experience has been that it leads to an increase in a disordered gut bacteria. And so replacing the normal flora, the normal gut bacteria, is critical for good long-term health after gastric bypass, as it is in normal non-bypass patients as well. So we strongly recommend that yogurt be part of your regular diet, and we want to be cautious about the types of yogurt. We recommend, because the research is clear, on plain yogurt. When you take out the fat and have low-fat or sugar-free yogurts, they add in fake sugar and fake fats. And sometimes these artificial sweeteners can include polyols, xylitols, and things like that that can be associated with gas and cramps and problems. And the artificial fats can also occasionally be associated with problems. So if you notice that the fat-free, sugar-free yogurt tastes pretty much like fat-full and sugar-full regular yogurt, they have to have replaced the normal fat and sugar with other chemicals. And sometimes these chemicals can be problems for our patients. So we prefer, because the research is so good, on plain yogurt, and we like it as considered as medicine. As you know, the reason behind all the additions to yogurt are because yogurt's kind of unpleasant tasting. It tastes like sour milk. So even though it's unpleasant tasting to some patients, we think it's really important, and we'd like to view it more as medicine. It's critical that you take some, even if you only take 1 teaspoon several times a day, we think that's more helpful sometimes than taking some of these other artificially flavored, artificially fat-removed type of yogurts. So plain yogurt we recommend for a lot of reasons. Calcium content, and we have another talk on the video about the new research on calcium supplements, and we really prefer dairy forms of calcium, and we really prefer yogurt. And we're going to talk a lot about that as we go through some of the other topics here. So yogurt, yogurt, yogurt. I think that's really important. So lactose is a kind of the classic example, but there's a bunch of other foods with various other components that are problematic for digestion. And so another example is fat. Now fat is very difficult to digest, but we are fitted with kind of a miraculous system by God so that we can digest fat. And that miraculous system starts right after the stomach in the length of the GI tract. Just as a reminder, the gastrointestinal tract runs from the esophagus, the long swallowing tube that goes through the chest, drops down into the stomach, which is this big reservoir, so we can expand and take in a whole turkey dinner. And then below that, there's a quick C-shaped circle called the duodenum. That's the beginning of the small intestine. And right here, just beyond the stomach, just beyond the pyloric valve, which opens and closes to let the food go from the stomach reservoir into the duodenum, there's a connection between the liver, the gallbladder, and the pancreas. And as food comes out into this area, the miraculous system that helps us digest fat occurs. And so right here, the liver creates and synthesizes green detergent bile. The gallbladder stores that up and squirts it into the slurry of partially digested fatty foods. And the pancreas secretes lipase, which is an enzyme which helps break down fat. Now, fat is difficult to absorb, and the way to understand that is to think back to an old dishwashing commercial called Dawn dishwashing liquid that used to advertise on TV. And in this commercial, or if you can envision this in your mind right now, envision a sink ready for the supper dishes. And into that sink, coming from off the TV screen into the center of the sink, is a greasy plate of a spaghetti plate covered with kind of oils and things like that. And as that goes into the water, I'm sure you've all seen it where little blobs of fat appear on the top of the sink water. And the reason that occurs is because oil and water don't mix. As we know, they do not mix, so they don't dissolve, so it's hard to digest that fat. But suddenly in from the other side of the TV commercial screen comes this squirt bottle of aqua-colored Dawn dishwashing liquid. And when that detergent is squirted into the water, we see those little bubbles of fat dissolve. Okay? And that dissolution of those fatty blobs of oil is what we need to help digest our food when we have fat in our gut, because we are mainly water, and oil and water, again, don't mix. So right beyond the stomach, as fatty foods partially digested in the stomach come into that duodenum, the gallbladder and pancreas squirt in a detergent called bile. And that bile is a detergent just like Dawn dishwashing liquid or like the dishwashing liquid you use at home. And it helps then dissolve, that is, mix the fat with the water, and that helps digest it. And this all occurs at a specific location in the gut. It occurs right beyond the stomach, in the beginning of the duodenum, beginning of the small bowel, and that area is critical for the digestion and absorption of fat. Now, remember, what are we trying to do with the mini-gastric bypass? Well, we're trying to interfere with digestion and absorption of fat, because as we said, digestion and absorption of fat is a miracle, and we give thanks for that, but in our patients, it's working a little too well. We want to thank God for that miracle, but in the patient who's overweight, the digestion and absorption of fat is working so well that it's actually pathologic. It's a disease, so that they are overweight and sick from some of the illnesses of the excess ability to digest and absorb fat. So with the bypass, we interfere with that very specific location, which is critical with the digestion and absorption of fat. So bypassing that area doesn't block all the fat absorption, but it decreases it significantly. Now that has implications for gas production. When we bypass this area, it means that when you eat a fatty meal, a significant portion of the fat won't be digested well. Now, it's variable. It depends on how fast you eat, how much you eat, how much of what you eat is fat, and how fast it moves through the gut. But basically what we can tell you is that after the gastric bypass, particularly the mini-gastric bypass, which is a distal gastric bypass, there's a significant malabsorption of fat. And when that occurs, that means that the fat is allowed to be left behind in the gut. Okay? A piece of fried chicken eaten by a normal, healthy person who has a normal, healthy duodenum will digest and absorb a large percentage of the fat from that greasy chicken wing. Okay? But with a mini-gastric bypass, much of that fat will not be easily digested and remain in the gut. That's good. That's partially the reason behind the massive weight loss, the drop in cholesterol, the lower triglyceride levels, and all the other benefits of the surgery. So there's a good advantage to this bypass. But if you put too much fat in, then there's a disadvantage in that that fat left in the gut will go down into the lower small bowel and into the colon, and there the bacteria that are living there will say, oh, he didn't eat this fried chicken, we will. And when that occurs, particularly with meats and other things that are high content of sulfide, there'll be a lot of gas production. So high-fat meals, high volume of high-fat meals leads to lots of gas, and so this also tells you how to protect against that. Eat low-fat meals and eat small volumes. Also, there are a variety of other foods that contain chemicals like starches and things like that, which are known to cause gas. And so, just like lactose can have a problem, we all kind of have heard about beans. So beans have an oligosaccharide, a type of starch, that can cause problems with digestion in some people. And again, those would be the kind of food that if you're having problems with gas, you want to exclude from your diet to see if that might be contributing to the gas, and choose other kinds of things. Now, sometimes you can have small amounts of beans, you can have cooked beans, you can wash the beans, there are other things to look at that. But if you're having problems with gas and problems like that, one of the things you want to look at is the other foods that can be associated with malabsorption of the particular food components, allowing the food to go down to the colon and be digested and cause that gas. Other examples are some of the cruciferous vegetables, cabbage, Brussels sprouts, foods like that can be associated with sometimes broccoli, particularly can have a lot of sulfide in it, so you want to look at that. And so what we recommend then is to, first of all, if you're having problems with gas and cramps and bloating, you want to look at your diet. If it's easy, sometimes you can just say, oh, I'm eating a lot of fat, I'm eating a lot of dairy, I'm eating a lot of meat which has fat in it, things like that. You may be able to control it easily. If it's not easy to manage, then what you can do is do a food diary along with the medicines and supplements you're taking and send that along to me by email, and we'll help point that out. So we've had some funny emails like that where a patient was having a lot of problems with gas, and you could see during the day she'd have 3 cans of Vienna sausages, beanie weenies. And that was kind of a joke that we kidded about. I said, that's probably not a good choice. It's high fat, it's not the best quality meat. She said she really liked them, but we said, yeah, but they cause a lot of gas. So a food diary can help. Now there's some basic things you can do then that's just some good advice. Eat a healthy diet. Eat yogurt every day, at least several times a day, in small amounts. If you don't want to eat a lot of yogurt, you can eat just a little bit, a spoonful 3 or 4 times a day. Just consider it as medicine, replacing the gut with that healthy bacteria. And we'll have some, and we do have some other videos on this on the internet. The healthy diet that you want is the diet that everybody talks about all the time. You can call it a Mediterranean diet. It's really simple. Michael Pollan has an article, has a nice little book on what to eat. We have some videos from him. But basically all we're saying is, what do you want? Fresh fruits and vegetables, and whole wheat, whole grain foods, and light, low-fat kinds of meats, so like fish, chicken breast, and things like that. These usually work to give you a pretty healthy diet. Now there are some tricks. There are some patients who, for example, have trouble with wheat and gluten, and we have some other talks we can do about that. There is this FODMAP, or FODMAP, which is fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, which is a rare form of problems which can cause gas and cramps and bloating. And I'll try and do another video on that. But sometimes the xylitol, which can be in sugar-free gums, sometimes fructose, which can be in honey and other things, high fructose corn syrup and sodas, stuff like that, which you not want to drink because of the carbonation. But this will give you a beginning talk, a little bit of an overview on gas in the gut. And most of our patients can do very well, and usually it's easy to identify these problems. So if you have difficulty after listening to this and thinking about it and looking on the web, please email me, and particularly it's helpful if we can get a food diary for a week or two, a list of your supplements and other medicines you're taking, and we'll be happy to help. Thanks very much. Have a good day.